Today, we have our interns joining us. They introduce themselves, and in today's episode, we are going to be talking about what they do, what they hope to accomplish, and their experience working at the Urban Health Collaborative. I'll open the floor to you guys to introduce yourselves.
Thanks, Zaire. Hey everyone, I'm Kayla Tarani, and I'm the Social Media and Digital Communications intern here at the Urban Health Collaborative for the summer.
Hi everyone, my name is Danica and I'm the Community Health Educator intern for the Urban Health Collaborative this summer.
Hey everyone, I'm Zach, and I'm the other Community Health Educator intern for the Urban Health Collaborative this summer.
And I'm Isabel. I am the Business and Creative Arts intern for the Urban Health Collaborative this summer.
And my name is Lori, and I am the Public Health Research intern for the Urban Health Collaborative this summer.
So to start off, using your degree and all of the experience you have within your current field, what type of career do you want to build? What are you passionate about?
So, I'm studying biological sciences in college, and I'm interested in it because I hope to apply to either PA school or medical school in the coming summer.
I'm also going to major in bio, and I'm also minoring in psych and public health. Career-wise, I hope to apply to medical school in the near future, and I hope to pursue something in public health as well.
So I'm currently studying exercise science on a physical therapy track. So after graduating from Rutgers, I plan on going to PT school and completing my doctorate.
So I'm studying music and business up at college, and I'm interested in it because I love music as a form of creative expression. I love performing. I love listening to music. So I feel like I kind of want to have my career center around that. And with business, I think that there's a lot of elements of music production that it helps to at least kind of know the basics of business to be able to navigate the music industry.
Well, I'm doing something entirely different. I'm majoring in IT, so I hope to do something with IT in the future, whether it be web design or UX UI design. And while I'm here, I hope to kind of build my skills in UX UI so that in the future I can secure hopefully a job.
So how did you guys hear about the Urban Health Collaborative?
I found out through the RSSI program. Otherwise, I probably would not have learned about the organization, but it's pretty cool.
Yeah, from talking with Zaire, I found out a little bit more about the Urban Health Collaborative, but initially I learned about it through the Rutgers Summer Service Internship Program.
Staying true to the team, I also found out about the Urban Health Collaborative through the RSSI program.
And just rounding things out here, I also found out about the Urban Health Collaborative through the Rutgers Summer Service Initiative, or RSSI.
Yeah, you could tell we're all from Rutgers.
I heard about the Urban Health Collaborative through one of my family members, actually. I was up at school and I was looking for an internship for the summer, and they told me, they're like, hey, there is this internship, it's at a nonprofit, and the executive director is saying that they're working on sort of like tailoring internships towards whatever particular like field of study the interns that they take on are interested in. And I thought that was really interesting, so I followed up and here I am.
I feel like now with all the resources we have, both digital and print, it's really interesting to hear about how we each just kind of came across the Urban Health Collaborative through similar terms. So to build off that question, what interested you about the Urban Health Collaborative?
So the main points that interested me about the Urban Health Collaborative were the fact that it was going to deal with both community outreach and a little bit of involvement with the public health sphere.
What interested me about the Urban Health Collaborative is the fact that it's so involved in a variety of programs, all of which are really dependent and intertwined within the aspect of research and having to conduct research for these programs. So as someone interested in research, that's initially what drew me to the Urban Health Collaborative.
So what interested me about the Urban Health Collaborative was just how much community involvement and development is in like going on here. So just like collaborating with other organizations and things that are in the area in order to increase or better the health outcomes of the youth and just people in the area. I think that those things are just very important in developing a strong community.
During your employment at the Urban Health Collaborative, how did you hope to interact with the community?
Yeah, for sure. I think what interested me about the Urban Health Collaborative, kind of going back to what I was saying earlier, was just how they really tailor what you're gonna do in your internship based on what you're studying in college. And I thought that that was really interesting, just because I'd never really heard of an organization that did that before. You know, like having public health interns, business interns, art interns. I thought that that was just really interesting because you build a team that's so versatile in their skills. I thought that that was really cool.
During your employment at the Urban Health Collaborative, how did you hope to interact with the community?
So as a public health research intern, most of my responsibilities include some kind of involvement with research. So while my role isn't a direct impact with the community, I definitely work a lot with gathering articles and doing background research for programs, which in turn does help with community outreach. Aside from my responsibilities as a public health research intern, I've also gone to a few outreach events where I man a few tables for the thrift store, or I helped interact with the community on behalf of the Urban Health Collaborative.
So when interacting with the community, one of my hopes for helping with just making an impact is just going out and actually speaking to people and hearing their stories and hearing about how we are able to impact them and how their stories and then impact us and how we're able to help other people in the future.
I think with the concerts that we're planning to hold in August, I'd love to work with the artists that decide to perform there. If we decide to collaborate with any small businesses, I would love to work with them as well, because I think that having so many different parties get involved in a community-wide event is a nice experience.
Well, for me, most of my work is digital, so I probably won't be going out physically interacting with people as much. But digitally, I kind of want to make my mark and reach the people through social media or digital communications and see how it goes from there.
So my hope in interacting with the community essentially is basically just to really get our feet on the ground and kind of get the ball rolling. I think that a lot of the programs that we have to offer are very beneficial to the local communities that surround this area, and I think it would just be advantageous for us to really just get started with them.
What do you believe is the importance of fostering a sense of community?
I think fostering a sense of community in both aspects, in the idea that we'd like to foster a sense of community within the Urban Health Collaborative and also in the larger New Brunswick community, it really helps everyone come together. Everyone can unite under a common set of values and goals and ideas. And I think with what we're trying to do here, having that sense of community definitely helps not only propel our mission statement, but also just be able to provide a united front.
And going off of that, I think it's important to create a feeling of community because it establishes a desire and a passion for change, not just in our own circles, but in other circles that we are able to provide for.
For me, fostering a sense of community is super important because just making sure that everyone is cared for and that everyone's needs are met in whatever capacity that we can as a collective is important. I also really like to think about the youth in this and that, what do they say? It takes a village, right? To raise a child, and so it takes a community to help develop the youth and to give them the tools that they need in order to succeed in the rest of their life.
I think it's important to create that feeling of community because we all have our own goals and things that we want to pursue. But I also think that, showing support for the people around you and receiving support from the people around you is really, really important. And I think you create that feeling of unity when you foster a sense of community.
Yeah, those are really touching, to be honest. What is one of your favorite projects, initiatives that you worked on so far at the Urban Health Collaborative?
One of the projects that I'm currently working on is CPR and other basic life skills program for the community. Really, the aim of the project is to educate the community about CPR skills, choking skills, stroke recognition skills, a lot of basic life support skills that would be really beneficial for the community as a whole to be educated about. Yeah.
One of my favorite projects that we worked on so far at the Urban Health Collaborative has been this podcast. You know, all of the planning that went into outlining the first season to the second season and the third season, and knowing that we can now begin producing all of the episodes of the podcast. That's been really exciting for me and easily my favorite part.
So one of the projects that I'm really excited to be working on is figuring out ways to help combat period poverty, which is basically when, especially in youth, but it's basically when an individual doesn't have the funds or the resources or access to menstrual hygiene products or the information that comes with just reproductive health and hygiene in general. So I've been working towards and doing a lot of research around creating programming for middle and high school aged or even college aged menstruators that would allow them the opportunity to meet people and share their experiences with their periods, as well as be able to work together to give back to the community by having meetings where they meet and create period kits to donate, just doing things like that so that not only are they gaining for themselves, but they're able to also give back to the same community.
I'd say my favorite project that I'm working on involves an educational and mentoring program for middle school aged kids. So that's grades 5 to 8. Basically, the goal of that program would be to instill mindfulness practices as well as studying tools, test prep, and various other educational guides as these kids basically grow up and move on into other transitional periods of their lives.
Well, part of my project is actually this podcast where different seasons we'll be discussing topics concerning different issues such as the arts, health, public policy, or criminal justice, which are all issues that we care about here at the Urban Health Collaborative. And I also plan on designing perhaps an app where you can access these podcasts as well as access other resources that the Community Corner and the Urban Health Collaborative offer. And that's what we're all doing here. So we've been keeping at it. We've been pretty busy.
How would you like to help the Urban Health Collaborative grow? Are there any particular ideas you'd like to bring to life?
So one of the ways that I'd like to help the Urban Health Collaborative to really just grow and thrive would be adding more programming specific to urban youth who identify as part of the LGBTQ community. I feel like it's really important, especially in urban communities and for Black and brown kids who may have even more negative experiences when you start compounding being different underrepresented groups. I just think it's important for them to have a space where they can find mentorship, where they can find friendship, where they feel maybe not super safe, but just safer than perhaps at school or at home, where there's somewhere that they know that they can go, that they won't experience any negativity.
Something that I've thought about that I think would be really cool is creating a practice space or a recording space for artists to use and kind of have that be an accessible resource to musicians who are just starting their careers, bands who need a practice space. I think that would be another kind of fun way to contribute to the community.
I think one way to help the Urban Health Collaborative grow would be to establish stronger mentorship programs. And by that I mean getting people who want to be involved in the community and want to provide, just guidance to people who are just people in communities who are disadvantaged and are struggling to find those resources within their own personal circles.
One way I hope to be involved in the Urban Health Collaborative's growth going forward is helping the Urban Health Collaborative establish meaningful connections with other nonprofits, other organizations, like for example, the clubs and groups at Rutgers who may have mission statements very similar to ours. We have a plethora of different programs, and I believe that a lot of their mission statements may align with a lot of the clubs at Rutgers or other organizations nearby in New Brunswick. So I believe that by making these partnerships, we can really help further the growth of the Urban Health Collaborative.
For those who resonate with our mission and vision, but are unsure of how they can collaborate with us, what is one thing you would tell someone who is thinking about trying to work with us, but is unsure how they would fit in?
Honestly, the Urban Health Collaborative covers so many bases that there is almost 100% like a chance that it would fit in with what we're doing, as long as it's something that pertains to helping to develop the community or just really anything in general. Like earlier, some of our interns were talking about how their internships here don't necessarily pertain to public health specifically, but there's also a lot of behind the scenes things that go on in terms of our programming. So like if you're interested in like business or music production and things like that, you can always still come by and collaborate with us in order to provide for the community.
And kind of going off of Danica's point, I think a really easy way to do that would be to just sign up for a couple of days as a volunteer. There's always, work that can be done, and, it's always good to get, I think, hands-on experience, and I think one of the best ways to do that is to just kind of throw yourself into the fire and see how it goes.
One piece of advice I would have for anyone coming in, be it as a volunteer or as an intern, is just have an open mind. Coming onto here, you will definitely have a lot of big learning experiences and opportunities to grow. And like Danica said, there is so many different aspects of the organization you can get involved in, and no matter your role or responsibility, you'll have a bunch of different responsibilities within that may reflect different areas of this organization.
I would say that the Urban Health Collaborative is a really welcoming space if you're unsure about how you would fit in. Our executive director is phenomenal at creating our internship programs based on what our interests are, and all of the activities that we're doing, all of the projects that we're taking on, they're centered around what we're truly interested in, and it's overall been a really great experience.
Well, Zaire, when I first got here, he was very welcoming. He was very flexible, and he's open to as many ideas as you can think of, as long as they relate to our mission and vision. And I couldn't have said it better myself. Zach, Danica, and Lori probably said everything that was on my mind. But to ease your anxiety, in case you have any, don't worry. We're very welcoming over at this organization.
So, as we wrap up today's episode, Kayla and I wanted to thank you all for coming on to the podcast with us. It was great to hear from each and every one of you about your passions, your goals, and what being at the Urban Health Collaborative has meant to you.
Yeah, for sure. I think it's really important to get to know the people behind the work being done here. I think especially when you're working in a team, getting to know each other is really important. We're all invested in the work we're doing, and having it shape the environment we're in has made this experience all the more enjoyable. So yeah, thank you. We're going to hand it off to Zaire to wrap up today's episode.
Thank you for tuning into the Community Corner podcast. We hope you enjoyed our story, and we can't wait to share it with you next time. And that's a wrap.